Chapter 1. Health and Illness. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How's your health generally? If you are in good health, you are well and have no illness. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong, not ill. Healthy, fit and well, very well, well, in good health. Ill, unhealthy, unfit, unwell, in poor health, poorly, not well or not very well. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings. I was ill this morning. I felt unwell this morning. I vomited this morning. Patient says, I feel sick. Possible meanings. I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patients made a good, full, or complete recovery. If a patient's health is in the process of returning to normal, the patient is improving, the opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. Get over, to recover, get better, to improve, get worse, to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, she remains in complete remission. Now I'm gonna read in Spanish. Capítulo 1. Salud y enfermedad. Una pregunta sobre la salud. La salud es el estado del cuerpo cuando los médicos quieren saber sobre el estado habitual de un paciente. Hacen preguntas como ¿cuál es tu salud en general? ¿Cómo está tu salud en general? Si goza de buena salud, está bien y no tiene ninguna enfermedad. Si está sano, normalmente está bien y puede resistir la enfermedad. Si está en forma, está bien y fuerte. No enfermo, saludable, en forma de bien, bien, muy bien o en buena salud. Enfermo, indispuesto, mal de salud, no bien o no muy bien. Enfermedad. La enfermedad tiene un significado similar a la enfermedad. También se utiliza en los nombres de unas pocas enfermedades específicas. Por ejemplo, la enfermedad del sueño y la enfermedad del viajero. Los pacientes también hablan de enfermedad cuando sienten náuseas y vómitos. El paciente dice, estaba enfermo esta mañana. Posibles significados. Estaba enfermo esta mañana, me sentí mal esta mañana o vomité esta mañana. El paciente dice, me siento enfermo. Posibles significados. No me siento bien, me siento enfermo, tengo náuseas o siento la necesidad de vomitar. La combinación de enfermedad y diarrea significa vómitos y diarrea. Recuperación. Cuando los pacientes vuelven a la salud normal después de la enfermedad, se han recuperado. También podemos decir que el paciente ha hecho una buena o completa recuperación. Si la salud de un paciente está en proceso de volver a la normalidad, el paciente está mejorando. De lo contrario, se está deteriorando. También podemos decir que el estado del paciente mejoró o se deterioró. En el habla a menudo usamos el verbo get para hablar sobre el cambio, conseguir terminar una enfermedad o recuperarse, conseguir estar mejor o igual a mejorar, no conseguir nada igual a deteriorarse. Si un paciente está mejor pero luego se pone peor de nuevo, el paciente ha recaído. Otra palabra para mejorar, especialmente en condiciones recurrentes tales como el cáncer, es la remisión. Superó la enfermedad muy rápido o 2 años más tarde se encuentra en remisión completa. Exercise 1.1. Complete the table with words from A and B opposite. The first one has been done for you. Noun, fitness. Adjective, fit. Health, healthy. Illness, ill. Sickness, sick. Exercise 1.2. Make word combinations using a word from each box. Look at B and C opposite to help you. Complete, feel, get, poor, travel, sickness, health, remission, sick, over. Combination words. Word combinations: complete remission, feel sick, get over, poor health, and travel sickness. Exercise 1.3. Complete the conversation. Look at B opposite to help you. Doctor, how are you feeling today? Patient, not very well. How long have you been feeling unwell? About a week. What is your health like normally? Very good. I'm usually quite healthy and fit. What is the problem now? It's my stomach. Do you feel nauseous? Yes. Have you actually been sick? No. Have you had any serious illnesses? No, none at all. Exercise 1.4. Choose the correct word to complete each sentence. Look at B and C opposite to help you. Her condition deteriorated and she died. He recovered and was allowed to go home from hospital. The cause of sleeping sickness was discovered in 1901. The patients made a full recovery. I have been in good health for months and feel very fit. It was a month before I got over the illness. He seems to be rather and healthy. His diet is bad and he never exercised. Chapter 2. Parts of the body 1. Parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in brackets below. How, neck, shoulder, armpit, upper arm, elbow, back, buttock, wrist, thighs, calf, leg, chest or thorax, breast, stomach, tummy, abdomen, navel, umbilicus, hip, groin or inguinal region, knee, and shin. Limb means arm, upper limb, or leg, lower limb. The trunk is the body excluding the head and limbs. For a more detailed diagram showing parts of the body, see Appendix 1 on page 130. Referring to parts of the body, when patients speak about their problem, they often refer to a part of the body. I'm having trouble with my hip, shoulder, knee. The doctor often needs to ask about a part of the body. Do you get any pain in your chest, stomach, or back? Describing radiation of pain. A patient is telling the doctor about his back pain and the parts of the body it radiates to. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh to knee. Now I'm gonna read this in Spanish. Capítulo 2. Partes del cuerpo 1. Partes del cuerpo. La mayoría de las partes externas del cuerpo tienen nombres comunes en inglés, así como nombres anatómicos. Los médicos normalmente usan los nombres en inglés, incluso cuando hablan entre ellos. Hay algunas excepciones en las que los médicos usan el nombre anatómico. Estos se muestran entre paréntesis a continuación. Mandíbula, cuello, hombro, axila, parte superior de brazo, codo, espalda, nalgas, muñeca, muslo, pantorrilla, pierna, pecho o tórax, pecho, estómago, barriga, abdomen, ombligo, cadera, ingle y rodilla. Extremidad significa brazo, extremidad superior, la pierna, extremidad inferior. El tronco es el cuerpo excluyendo la cabeza y las extremidades. Para ver un diagrama más detallado que muestra las partes del cuerpo, consulte el apéndice 1 en la página 130. Refiriéndose a las partes del cuerpo, cuando los pacientes hablan de sus problemas, a menudo se refieren a una parte del cuerpo. Estoy teniendo problemas con mi cadera, hombro o rodilla. El médico a menudo necesita preguntar sobre una parte del cuerpo. ¿Tienes algún dolor en el pecho, en el estómago o en la espalda? Descripción de la radiación del dolor. Un paciente le cuenta al médico sobre su dolor de espalda y las partes del cuerpo a las que se irradia. Comienza en la parte de atrás, luego parece entrar en la nalga derecha y bajar por la parte posterior del muslo derecho hasta la rodilla. Exercise 2.1. Write the ordinary English words for the corresponding anatomical terms. In the table, using your medical knowledge, look at A opposite to help you. Anatomical term: abdomen. Common word: stomach or tummy. Axilla, armpit. Carpus, wrist. Coxa, hip. Cubitus, elbow. Mama, breast. Nates, buttocks. Patella, kneecap. Exercise 2.2. Complete the sentences using ordinary English words. Look at A and C opposite to help you. Male patients describing angina pectoris. It's like a thickness across my chest and it goes up into my neck how and into my left shoulder and down the left arm. A male patient describing renal colic. It starts in the loin and goes into the groin and down into the testicle. Exercise 2.3. Complete the sentences. Look at A opposite to help you. Anatomical term: inguinal swelling. Patient's statement: I've got a lump in the groin. Abdominal pain: my little boy's got a ache, tummy, or stomach. Periumbilical rash: I've got some spots around my navel. Thoracic pain: I've got a pain in the middle of the chest. Enlarged axillary node: there's a painful swelling in my armpit. Mandibular pain: I've got a pain in my jaw. Exercise 2.4. Complete the table with words from the box. The first one has been done for you. Trunk, abdomen, chest, loin. Upper limb, elbow, finger, right arm. Lower limb, knee, leg, thigh. Chapter 3. Parts of the body 2. The abdomen. The main organs of the body have ordinary English names, and doctors use these words, but when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example the pancreas, have no ordinary name. Pancreas, stomach, spleen, left kidney, right kidney, liver, gallbladder, and duodenum. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. The chest or thorax contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into two lobes, and the right into three. The airways consist of the larynx, the trachea, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explain the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter. One on each side, the ureter carries the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urinary passes down another tube called the urethra to go outside. Now I'm gonna read this in Spanish. Capítulo 3. Partes del cuerpo 2. El abdomen. Los órganos principales del cuerpo tienen nombres comunes en inglés y los médicos usan estas palabras, pero cuando se necesita un adjetivo, a menudo usan una palabra anatómica. Por ejemplo, podemos decir enfermedad del hígado o enfermedad hepática. Algunos órganos abdominales, por ejemplo el páncreas, no tienen un nombre corriente. Cuando los médicos hablan de las partes principales del sistema digestivo, usan las palabras intestino, el intestino delgado y el intestino grueso. Al hablar con los pacientes, los médicos pueden referirse al ano y al recto como el conducto de atrás. El pecho. El pecho o tórax contiene los órganos de la respiración y el corazón. Las partes principales del sistema respiratorio son las vías respiratorias y los pulmones. El pulmón izquierdo se divide en 2 lóbulos y el derecho en 3. Las vías respiratorias consisten en la laringe, tráquea, los bronquios derecho e izquierdo y los bronquiolos. El tórax está separado del abdomen por el diafragma. La pelvis. Un médico está explicando la función de la vejiga a un paciente. La vejiga está situada en la pelvis, como saben, y está conectada a cada riñón por un tubo largo llamado uréter, uno a cada lado. Los uréteres transportan la orina desde los riñones hasta la vejiga, donde se almacena hasta que decidas vaciar la vejiga. Cuando eso sucede, la orina pasa por otro conducto llamado uretra hacia el exterior. Exercise 3.1. Label the diagram using words from the box. Look at B opposite to help you. Number 1, one pipe, lung, lungs, diaphragm, airways, heart, and bronchioles. Exercise 3.2. Match the conditions with the organs affected using your medical knowledge. Hepatitis, liver. Pneumonia, lung. Nephritis, kidney. Gastric ulcer, stomach. Cystitis, bladder. Angina pectoris, heart. Cholecystitis, gallbladder. Ulcerative colitis, large bowel. Exercise 3.3. Complete the textbook extract Look at A and C opposite to help you. Examination of the abdomen. To examine the patients for enlarged abdominal organs, first feel for the liver and the gallbladder on the right side. To do this, ask the patient to take a deep breath while pressing with the fingers upwards and inwards. Next, feel for the right kidney and then cross over to the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only felt if it is full. Chapter 4. Functions of the body. Eating. You are hungry. You are in a restaurant and the waiter brings your food. You smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good and you shall it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting. As the food you've eaten sometimes has disagreed with you. The five senses. In addition to smell and taste, the senses include sight, hearing, and touch, also called sensation or feeling. To ask about the sense, doctors use the questions: what is your sight, hearing, sense of smell, sense of taste like? Or is your sight, hearing, sense of smell, sense of taste normal? To ask about the sense of touch, doctors talk about numbness, loss of sensation. Have you noticed any numbers in your fingers or toes? Other functions. Function: speaking, verb speak, noun speech, walking walk, gait, breathing respiration, inhale breathing, take a breathing, exhale breathe out, breath. Urination, micturations, urinate, micturate, pass urine, pass water, urine. Defecation, defecate, pass faces, pass stools, faces, stools. Menstruation, menstruate, have a period, menstrual period, monthly period. When taking a history, doctors can ask: do you have any trouble, difficult problems walking, breathing, passing urine, or with your speech? Do you have any pain when you're breathing? When auscultating a patient's lungs, the doctor tells the patient: take a deep breath in, hold your breath, then breathe out completely. Less common functions. There are some times we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask: do you sweat, shake more than usually? Now I'm gonna read this in Spanish. Funciones del cuerpo. Comer. Estás hambriento, estás en un restaurante y el camarero te trae la comida. La hueles, estimula tu apetito, quieres comer, se te hace agua a la boca llenándose de saliva. Le das un mordisco a la comida, sabe bien y lo masticas y lo tragas. Comes más, pero de repente sientes algo desagradable y te dan náuseas. Te apresuras al baño y llegas justo a tiempo antes de vomitar toda la comida que has comido. Algo no te ha sentado bien. Los 5 sentidos. Además del olfato y el gusto, los sentidos incluyen la vista, el oído y el tacto, también llamado sensación o tacto. Preguntar acerca de los sentidos. Para esto los médicos usan preguntas como: ¿cómo es tu sentido del olfato o sentido del gusto? ¿O es tu vista, tu sentido del olfato normal? Para preguntar sobre el sentido del tacto, los médicos hablan de entumecimiento o pérdida de la sensibilidad. ¿Has notado algún entumecimiento en los dedos de las manos o de los pies? Otras funciones. Función, discurso, verbo hablar, adjetivo, discurso. Caminando, caminar, paso. Respiración, inhalar o exhalar, aliento. Micción, orinar o orinar o orina. Defecación, defecar, hacer heces. Menstruación, menstruar, tener un periodo menstrual o periodo mensual. Al tomar un historial, los médicos pueden preguntar: ¿usted tiene problemas o dificultad al caminar, respirar, orinar, al hablar? O también, ¿usted siente algún dolor cuando respira? Al auscultar los pulmones de un paciente, el médico le dice al paciente: tome una respiración profunda, contenga la respiración, luego respire por completo. Funciones menos comunes. Hay algunas cosas que hacemos con menos frecuencia. Cuando tenemos calor, sudamos. Cuando estamos nerviosos, temblamos. Cuando estamos tristes, lloramos. Los médicos pueden preguntar: ¿ha sudado más de lo usual? Exercise 4.1. Match the symptoms to the questions using your medical knowledge. Dysuria. Do you have any pain when you pass water? Dysphagia. Do you have any trouble swallowing? Diplopia. Is your vision normal? Dysphasia. Do you have any difficulty with your speech? Dyspnoia. What is your breathing like? Exercise 4.2. Patients are describing symptoms of the conditions shown in brackets. Complete the sentence. Look at C and D opposite to help you. I've got pain and numbness in both feet. I'm having difficulty swallowing solid food. I have a lot of problems passing urine. I've been sweating more than usual. Even when it's not hot, I've noticed that my hands shake when I'm not using them. I have trouble breathing when I climb stairs. Exercise 4.3. Complete the sentences. Look at A, B, C, and D opposite to help you. When I hit solid food, I have to chew it for a long time before I can swallow it. Do you have any pain when you pass stalls? I have no appetite and I've lost 5 kilos in the last few weeks. When did you last have a period? The garden is full of flowers, but my sense of smell has disappeared and I can't enjoy the perfume. Take a deep breath in.